Hey guys, welcome back to Ada Sonia Live. I know my hair is braided today and you never see my hair braided or really up. So today I'm going to be talking to you guys about the deep brain stimulation for dystonia, and I'm going to clarify to you guys what it is, and I'm going to just tell you, well, because I already told you guys my story with the DBS. This is what that scar is. So you guys can feel free to check out that video if you guys want to. You guys are on a tripod. Like, look at that. You guys are amazing. So, let's get started. So, I have this pamphlet. I actually have a whole bunch of pamphlets. Like, all different kinds. Today, we're going to talk about the DBS. The deep brain stimulation. If you're a baby, because that's my nephew Chris. So the first question I tend to get is, the DBS like safe? So I'm gonna tell you. I'm reading from the pamphlet. Okay. So it is safe. The movement disorder field now is more than 2 decades of experience. The DBS main risk is the bleeding of the brain during the surgery of the implants of the leads, resulting in a stroke. This occurs about 1% of patients, infection 5% of patients. There are side effects with the DBS. It's not, but those side effects, just be aware of what happens with brain trauma or bleeding in the brain, or pretty much soreness, a lot. So just be aware of just the DBS and what can happen. So when you get the DBS, it typically requires 1 to 2 nights to stay at the hospital, and it will take several weeks for the leads to actually work and to have it fully healed inside of you. The benefits, it can definitely help your dystonia. Maybe not 100%, but it can help to get there. It may not be as stiff. It will probably be a little relaxed. There's benefits on it, but the DBS, just keep in mind, like, it did not work for me. It may not work for you, but it could work, Everybody's deep dystonia is different, so it may or may not work for you. But they have showed people with heavy dystonias, which what I have, that is a rare dystonia, so the DBS may not work because it's one-sided and it may not. So here's some questions that you can ask your doctor. So, are you a good candidate for a DBS? Meaning, like, do you think your dystonia can handle, and or you can handle the DBS? What are the steps of the DBS process? What are the risks? Those are really important to know. What are the benefits I can expect? What percentage of the DBS people develop a infection? It's super duper rare to get an infection. Like I said in the beginning, 5%. So not very many people get it, but it is rare. But you can get it. How long is recovery? Is there anything about the DBS I should know that we have not discussed? Like, you can't be in metal detectors. You just have to be cautioned because you are walking into a metal detector, so you are having a metal in your body, so just be caution, and it may or may not like go off, meaning it may buzz like a lot, or yeah, it may buzz. You will not explode. Doctors tell me that you will explode, but that's not true. Or it may feel like it. Another question you can ask: what is the experience of the surgical team for DBS with dystonia? So, yeah. And another thing, DBS can also be for people who have cerebral palsy and other muscle disabilities, but they have found out that it works better, a little bit more better with people with dystonia. But unfortunately, for me, it did not work. And if you do think about having the DBS, I would advise you to do research and just go for it too, because, well, you never know. Your dystonia may respond better or differently with it. I would give it a try. I mean, I had 2 batteries. Yeah, it didn't work for me. Here's a diagram that I found, and I'm going to show it to you. Okay, so as you can see, that's what it should look like on you. That's what it should look like. You can have it on your right side of your chest. You can even have it on your left side, left or right side of your body, or in some cases, depending on how bad it is, you can even have it like on the side of your stomach. It just really depends, and whatever works best for you and